Doctor, we are live now.
Okay, thank you. So good evening, respected seniors, dear colleagues, and young ophthalmologists. On behalf of TNOA, it's my proud privilege to welcome you all to the special webinar on iconic institutions in ophthalmology, where we spotlight one of the true pillars of Indian eye care, SANKARA NETHRALAYA. At this point, I'd like to thank Dr. TSS, the chairman of SANKARA NETHRALAYA, for readily agreeing to this webinar. And also my special thanks goes to JB for coordinating the entire process. When we speak of institutions that transform not just clinical practice, but the philosophy of eye care in India, SANKARA NETHRALAYA stands tall. It represents a seamless blend of clinical excellence, academic rigor, research innovation, and compassionate service. At the heart of this vision was its founder, Dr. S.S. Badrinath, chief as he is known to all of us, a man whose foresight went far beyond building a hospital. He envisioned a center of excellence in India that would match global standards, reduce the need for patients to travel abroad, and create a sustainable model where high-quality care and affordability could coexist. His foresight lay in three powerful ideas: that excellence must be indigenous, that training and research are as important as service, that compassion must never be compromised by scale. From a modest beginning, the institution evolved into a globally respected center for subspecialty ophthalmology, research collaborations, postgraduate training, and community outreach. It has inspired generations of ophthalmologists not just to treat disease, but to build systems, nurture talent, and serve society. Today, as we discuss iconic institutions, we are not merely recounting history. We are asking ourselves, what makes an iconic institution? Is it its infrastructure, technology, or surgical number? Or its vision, values, leadership, and endure beyond individuals? So that is what we are going to see today. As leaders and future leaders in ophthalmology, we must learn from such models to think long-term, build ethically, invest in people, and create institutions that outlive us. I'm certain today's deliberations will not only celebrate a great institution, but also ignite in us the courage to dream bigger and build better. I'd once again like to thank Dr. TSS for readily agreeing to this webinar and JB for coordination with the entire faculty. Thank you all for joining. Without much ado, I request Dr. J. Biswas, the man behind the show, who needs no introduction, to begin this inspiring session. Thank you. Dr. JB, you're muted, JB. Unmute. JB, you are.
Thank you, Dr. Sujata, for the kind introduction for the SANKARA NETHRALAYA and this excellent meeting. And it was your good brain child for organizing this kind of webinar. We have got among ourselves none other than Dr. P.S.
Surendan, who doesn't need any introduction. He will give the nostalgic memory.
He will give the nostalgic memory of our Institute SANKARA NETHRALAYA. Over to Dr. P.S.
Sir.
First of all, I must commend Sujata Mohan for initiating this wonderful symposium, or whatever you call it. The genesis of Nethralaya and the legacy of our chief, Dr. Badrinath. So first we started at voluntary health service, and myself, Mary Abraham, Chandran Abraham, and Beg, Maitri, then Anju Kulkarni, Vengu were there. And then from there to Vijaya Hospital. From there, Vijaya Hospital was in 1978 to 79. And then we switched over to the College Road. Before that, I would like to show the various facets of our chief. He was a mentor, he was a team builder, he was a guru, he was, I think, patient-friendly, humane, staff-friendly, and great surgeon, and also he was all in all. I think that was the towering personality of Dr. Badrinath. We are all fortunate to work under him. He deserves even Bharat Ratna, so we have government, we have written to him. We have to return to the government, we are yet to get a reply. Well, actually, when he started the institution, there was only, I think, that building what you saw was this. And this building, we had actually 1,000 rupees, 1,001 rupee donated by Sringeri Swamigal. And then later, I think seed money came from Mr. C.U. Shah. Then I think followed by borrowing from Andhra Bank, and then it went on and on. So this was about 30 grounds property at College Road, bought from Manekji. So he was actually the aspect of life and legacy, and most beloved gurus in the world of medicine, especially training so many alumni members. I'm very happy that people like Dr. Mohan Rajan, Natarajan, so many of them, Ramamurthy from Coimbatore, they are all running institutions, including our Sundaramurthy, etc. So it is actually all because of one man, Dr. Badranath, who actually built this team. The funding was not an easy task, as I told you. The initial, this thing, what investment Badranath created was only hard work, hard work, hard work. And he put us all into the group, and we were all assistant surgeons to start with. And his main achievement was starting subspecialty, and his wife, Dr. Vasanthi Badranath, was his great support. Chief had no hesitation to seek funding, and whenever the patient gets, I think if it's a wealthy patient and if it's with the money, he will have directly. This actually influence. This I'm planning to influence for all the successive consultants. I have taken part of fundraising presently, and he was supporting me that time. And we had conducted MS Subbulakshmi Kacheri, etc. And also we got a lot of, you are seeing Mukesh Ambani there. We saw, I think, a lot of wealthy people, right from Mr. Barwale and Sivasalam donated, Sivasalam family, Malika donated huge amount for our JKCN project. And then your KB Nirvo research block was from Kamal Nair and Bajaj Group. And apart from that, I think all the projects we had donations. So you need to find out the philanthropists and you must motivate them to. And the first group of fellows I have mentioned there, unfortunately, Lat is not there. Then we also lost Babu Rajendran, and Anandakan gave our flag hoisting ceremony. This was the first batch of consultants. And, another batch of consultants. This photograph was arranged by Natti, if I remember correct, one of the photographs. And the bond between Badranath and myself is shown in this picture. Actually, the cake cutting of my 60th birthday was done by the host by Dr. Badranath at Touch. And he called my wife and my son, and Meenakshi is peeping around. Not all the consultants were there. And like that, I think 65th year also he hosted me. And this bond has been going on. I've been a blue-eyed boy. I've been very lucky throughout my career, except one or two small misunderstandings. I have been sailing with him till the end. And you find Orbis being started. We have the biggest strength we have is the President of India, the Prime Minister, Mr. Manmohan Singh, all were treated here. And Dr. Badranath took care of them, and then he will get all the papers signed. Then you find the King of Spain also there. Mary Abraham is there. King of Spain opening the Venugopal block. First block was your old block, which I showed you, then Ramnath Iyer block, then King of Spain block. Then we have Magiko block, then KB Nirvo block, and it goes in order. Then I think 85, we had the elite school of optometry, which is now the backbone of all the ophthalmologists have one more optometrist or one or two optometrists, then Rural Eye Hospital, Shanai Nagar complex, RA Puram complex, and this is our main complex. And the main campus was named after Dr. Badranath. So JKC and Wellington was in 99, and then we just go to the mobile eye surgical unit, which was Badranath's brainchild. So he was not only, I think, he was an innovator. He also created the first bioengineering department to start in ophthalmology. He was the first to buy the argon laser. He was the first to buy the AG laser. He was the first to buy the Octome vitrectomy unit. And you can name anything. The first workshop also, along with Agarwal. He was the first to initiate the electronic medical records. Way back in 85 itself, he started using the computers. And SN alumni has been a very big strength to NETHRALAYA till date. I think how much endowment fund is now crossed 1 crore, thanks to the alumni, those who have given and those who have not given. So we have already done 3 orations, I will show you. And this is actually another optometry school, Vaidyalingam's scientific session, which was held at St. Thomas Mount. And our boardroom is named after Mohan Rao. Why I brought that boardroom was Dr. Badrinath started with 2 boards. First, initially, Medical Research Foundation, where Mr. Mohan Rao was the president, Vaidyanathan was the secretary. And I was made assistant medical director in 92, medical director in 98, 2004 vice chairman, then chairman now. And the inauguration of the refractive surgery unit, JKCN, these are all the achievements in the 3 years. Inauguration of renovated optical devices. Then Agastya TNK Sun campus is the next project. This is a 100,000 square feet building coming up in Rayapuram with 1.3 acres of land. And we are going to spend 100 crores. And we are blessed with Vijayendra Swamigal. And the building has started already. And a condolence meeting was held immediately after Badrinath's sick. This was the inauguration of the statue, and that was my brainchild. And though some were little critical, then we had the naming ceremony of the entire main campus after Dr. Badrinath and book release of Irungavel and mine on 24th February 2024. Then we also should have the political background. As I told you, presidents have been operated here, Prime Minister has come, and we had the fortune of having the present Chief Minister laying the foundation for our Agastya TNK. And also, we gave the name of Dr. S.S. Badrinath Road for the Pycroft's Garden Road. In 1 month's time, Pycroft's Garden Road is 200 years old. And S.S. Badrinath Endowment Lecture we started 3 years ago. That was, first was Gopal Gandhi, then Ravindra gave, then 3rd lecture was day before yesterday. And we also had Nambarmat Swami in between for the first anniversary. And this is day before yesterday. With that, I think I should conclude. With the future, I think last Dr. Girish Rao will cover. And then I'm just leaving it to the team to continue the legacy. God bless NETHRALAYA. God bless all SN alumni members. Bye-bye.
Thank you, sir. I request Dr. Mary Abraham to say a few words and her comments, please.
Thank you, Dr. Surendran, for your nostalgic introduction. I'm so happy and proud to be here today to share with you some of my thoughts on the early days at SANKARA NETHRALAYA. Some of you will know that Dr. Chandran and I were the first consultants of Dr. Badrinath, being employee number 3 and 5. Dr. Badrinath himself was employee number 2. My memories of the early days at SANKARA NETHRALAYA is that of pure joy, where it was a place where we went not only to work, it was like home to us. We had to build everything from scratch. Everyone worked with such pride in our hearts to make sure that this institution would stand the test of time. All of this would not have been possible if not for its great leader, Dr. S.S. Badrinath, who practiced what he preached. And no task was too small for him. Though a strict taskmaster and disciplinarian, he never hesitated to pat a person on the back for a job well done, or encourage ones who lagged behind until they too fell into the groove. There are a few things that all of us have learned along our way from our precious days at Shankara Nethralaya. One is that honesty, sincerity, and hard work pays. And there are no shortcuts whatsoever. A mutual love and respect for your fellow colleagues, employees, and patients alike was something that was ingrained into us. I'm sure all at Shankara Nethralaya will also agree with me on this fact that we were taught to treat the hospital as your home. We never wasted hospital property, making sure that all lights and fans were switched off when we finished work, and by keeping our instruments and rooms clean and tidy at all times. Dr. Badrinath and this great institution gave each of us a platform for us to shine by bringing in the latest technology, giving us adequate exposure in the national and international arena, thus making it possible for us to be responsible and confident ophthalmologists, ready to give back what we have learned to society. With this, I'm sure that these guiding principles laid down in the past by a visionary founder have paved the way for a safe and secure future of iconic institutions such as Shankara Nethralaya. God bless.
Thank you, ma'am. That was really very touching and very nice to hear. I'd request Dr. Prema Padmanabhan to say a few words about the cornea department. And before she opens her speech, I would like to recollect that Dr. PP and Dr. MK were such an inspiration because of the fantastic keratoplasties that they were doing those days. And the amount of research and publications they had done, I remember that probably the 27th Acanthamiba publication was from Shankara Nethralaya. Dr. MK had published that. And even at those days, about 30 years back, it was so inspirational. And today I'm doing whatever I know in corneas thanks to Dr. MA and Dr. PP. Over to you, ma'am, Dr. PP.
Thank you so much, Dr. Sunathan. This is a great opportunity to reflect on a 4-decade journey of the Department of Cornea and Refractive Surgery. Having been a part of it for all of those 4 decades and more, I feel in a sense like a bridge between the past and the future. Without doubt, it was the farsightedness and foresightedness of Dr. Badrinath that really set the pace for subspecialties to develop. Remember, at that time, the landscape of ophthalmology was so totally different from what it is today. By way of switching on the ignition, so to speak, he introduced us to Dr. G.N. Rao, who was and remains a great source of inspiration and whose guidance and encouragement were invaluable in those formative years. So with 2 giants, Dr. Badrinath and Dr. G.N. Rao, we had all the push and pull we needed to make a beginning. But success lies in continuity. And we've been fortunate in having a stream of absolute gems galvanizing the department and promising a bright future. Before you hear more of that in a minute, I want to mention 2 names that are really special. One is my predecessor, Dr. Manju Kulkarni, a retinal surgeon who became the first corneal surgeon in Shankara Nethralaya. The other is my immediate successor, Dr. G. Sita Lakshmi, whom I sorely miss today, who was the first woman in the world to perform the daunting surgery of OOKP. Not only have I been flanked by these 2 accomplished ladies, I have enjoyed every moment of working with every single member of our team. After being nurtured by Dr. Rama Rajgopal, who is sincerity personified, the department is currently in the safe and dynamic hands of Dr. Radhika, who will now give us a sense of the map ahead of us. Dr. Radhika. Over to you.
Good evening, everybody. Can you hear me?
Yes, Radhika.
I'll just share my slides in a bit. And while that is happening, my sincere thanks to Dr. Sujata Mohan and TNOA for having me here. Can you see my slides, Dr. Sujata?
Yes, absolutely.
So I'm Radhika Natarajan, and I presently head the Department of Cornea and Refractive Services in Shankar Nethralaya. Nethralaya, as we know, means Temple of the Eye. And I will start by paying my obeisance to the cosmic lord of this temple, the chief who was and will be Dr. Badrinath. Also, when some of us took over the reins of our departments, we can see further and better only because we have been observing closely the stalwarts who were our predecessors. Many of them are there in this forum, so our respectful gratitude to them as well. The C.J. Shah Cornea Services at Shankar Nethralaya was established in 1978 alongside the institute itself. And this was done because Chief saw a need for subspecialty ophthalmic care. And now the department consists of over 15 expert cornea specialists spanning across its centers. The departments are very well equipped with state-of-the-art technology to cater to patients suffering from a wide variety of corneal diseases. And in a year in Chennai alone, we treat about 500,000 outpatients and perform 1,300 refractive surgeries and over 700 corneal transplants year after year. The C.U. Shah Eye Bank was established in Shankar Nethralaya in 1979, but then the Department of Medical Sociology was added later with the aim of promoting awareness on eye donation and public education, which are integral to the functioning of an eye bank. And in the last 30 years, the eye bank has grown tremendously with increase in the number of eye donations. To put it in perspective, from 88 eyes which were collected in 1980, 1,200 odd eyes were collected by the year 2017, and we are still counting year after year. So I just want to share this historic photo with you, which depicts the eye bank being rededicated. And to commemorate this, a video was released well ahead of the time of social media. And this video had in it the superstar, Mr. Rajinikanth, sending out a clear, concise, and powerful message of eye donation to the public, which rippled across the southern states, promoting its movement. Refractive surgery came to Shankar Nethralaya in the year 2001, and presently we have a state-of-the-art refractive surgery suite in our hospital, which has all the pre-operative evaluations listed over there, and we offer surface procedures, flap and pocket-based procedures along with ICL. But what I consider the USP of our refractive clinic is not just the cutting-edge technology, but the pre-operative counseling and the post-operative care that we accord to the patients, where we try and balance the cosmetic needs of these young patients with the abundant caution that comes with operating on fully sighted eyes. So in this frame, you can see the diva of our department, Dr. G. Sitalakshmi. Very long back, she saw the need for a specialty clinic involving ocular surface diseases. So she built up a team which started doing procedures ranging from punctal cautery to surface reconstruction. And she trained under her mentor, Professor Falcinelli of Italy, to perform the complex surgery of modified osteo-odontokeratoprosthesis, which is the final ray of hope in terminal corneal blindness when other keratoplasties do not work. And when Dr. Sita passed, Professor Falcinelli dedicated the ocular surface department in Shankar Nethralaya to her memory. So with the commencement of the OSC clinic, the next logical step was to bring together like-minded people, and thus was born the OSCON conference. It has seen a couple of editions till now, and we have the next latest edition of OSCON right round the corner. The cornea department also offers a comprehensive fellowship program where the fellows are meticulously selected. They are oriented to the ethics and the structure of the institute. They're posted with all the cornea consultants to observe and learn from them. They're posted in the community ophthalmology segment to get their hands polished in surgery. They spend time in the emergency clinic looking and learning from cornea patients. But the cherry on the cake of the fellowship program is the senior residency, where the fellow handles the cases independently under the watchful eye of the cornea consultant. So at the end of 6 months of senior residency, their training wheels are ready to come off and they step out into their own professional world of cornea consultation. So along with clinical surgical work, they are also involved in a lot of academics. We hold regular classes. They do research with the consultants. They are encouraged to present and publish their work. Regular tests are conducted, and there is also a prize exam to encourage them. And here in this picture, you can see the endowment citation being distributed to the winner of the prize exam. So when I took over the charge of the department, I should not say I, because we have a lot of senior people in the department, so it's always a teamwork. We developed a mantra. So this mantra was that we, in addition to doing big things, will try and do a lot of small things bigger and better. So we launched a series of small initiatives, the first of which was conducting wet labs. Now you may ask what's so new about a wet lab, but this one was different because this was a refractive surgery wet lab. Cornea fellows don't have much access to doing this procedure because the patients are well-paying and high demanding, and it's difficult to conduct this wet lab in an institution. It is usually done in conferences by the instrument makers. So we overcame some of the logistic problems and gave them a hands-on experience with all the latest technology in refractive surgery. Here's another wet lab on corneal tattooing procedure, and you can see their smiles right after they have completed the hands-on training. Our ocular surface team of 3, headed by Dr. Shweta, also launched a novel initiative of developing a YouTube channel where they have brought together all of their ocular surface experiences as one resource point. And I should say they have curated an impressive playlist of items ranging from punctal occlusion to keratoprosthesis itself. So another initiative that we launched was a CME series called Meet the Masters. Usually when we attend conferences, there are subspecialists whose work we want to interact with them, but they are very busy. Sometimes even we are busy, we can't interact too much with them. So we thought, why not bring them home? So one master at a time is brought to Shankar Nethralaya every 3 months. And this is a who's who in the cornea subspecialty. They may be a refractive specialist or an infective keratitis specialist. They come and share their work with us. And then our fellows present in tandem, and we have the whole evening to interact with them for sharing of knowledge. And last but not the least, Dr. Badrinath was ahead of his time. He was called a visionary because he saw a lot of things ahead, be it the mobile surgical unit or the EMR or even the tele-consultation techniques. But what I truly view as his legacy is a feeling. In his own words, that feeling was called the sense of belonging to the SN family. So when the cornea fellows finish their training and get outside SN truly never gets outside them. I'm proud to say that we have 100 members strong cornea alumni group, and we interact closely with each other very often. And when these fellows go out and set up their practice, they transform into brand ambassadors. Brand ambassadors not just for the cornea department, but for our glorious institution, the Temple of the Eye. Thank you very much.
Thank you, Dr. Radhika. That was really wonderful, very inspiring. I request Dr. Manjukulkarni ma'am to say a few words and give her comments and her experience at Nethralaya.
Good evening to you all. Thank you, Sujata, for this opportunity, and thank you, Surendran, Girish Rao, JB, for having organized this excellent meet. I was one of the first one to do the corneal surgeries in Nethralaya, and at the outset, I would like to congratulate Dr. Radhika for having given such a beautiful presentation. I would also like to mention Dr. Mohandas Kini, who was Dr. Badrinath's friend and who was instrumental in training the first batch of all of us, Mary, Chandran, myself, Sridhar Rao. He sponsored us to come to Boston and be attached to Mass Eye Near, where we got our individual specialty trainings, and that was a very big help in the foundation of these subspecialties in Nethralaya. So after having got trained and after having coming back to Chennai, the greatest task was and a big challenge was to establish the cornea eye bank. And to get corneas was very, very difficult because there was no motivation, no knowledge about organ donation at that time. So I remember going to very many public places, schools, colleges, blood donation camps where I would give a talk on eye donation, and people will look at me with great puzzle in their expressions as to what am I talking about. And many had a lot of taboos about organ donation. So to start this eye donation campaign itself was a very big challenge. The second challenge was the storage, because we were only having moist chamber storage. We also did not have the collecting small boxes for getting the eyes to the institute. So I remember having gone to Devraj Mudli Street to a steel merchant, and I showed him the sample of the collection box, and he made those collection small boxes for me, and we were using them to collect the eyes. Initially, we were dependent on the Sri Lankan Eye Bank founded by Dr. Hudson Silva to get the donor eyes, as well as from Ahmedabad from Dr. Majmudar. But the storage was again a big problem. A lot of tissue would be damaged because of the time taken. Sometimes the temperatures were not maintained. The ice used was the regular ice and not the carbonated ice. So it would melt away, and the cornea would, having come from a very far distance, and collecting that donor cornea, getting the recipient itself was another big challenge, because many times they will say, oh, today we are not prepared for the surgery. Today is Rahu Kalam, today is Yamagandam. So all those things we had to overcome slowly. She has mentioned about Rajnikant. So we were trying all these aspects of getting in all the personalities, famous personalities, to talk about eye donation. We had one a program arranged where many of the cine actors came and they talked about eye donation. I remember Satyaraj having come, but the greatest achievement was when Rajnikant donated his eyes during one of the events, and that really flipped the matter of eye donation. The MK medium was finally made available to us through LV Prasad Eye Institute after Dr. Gulapalli Rao came to India, and he formed LV Prasad Institute, and that was such a great help for getting the media to store. And that was a very big leap towards corneal surgery. This amniotic membrane transplantation, a donor conjunctival stem cell transplantation were done even at those times by me and Dr. NS with patients having chemical burns. So we have acid burns. Some patients were done in Apollo, and not all were successful, but that was a very big way to start these surface surgeries at that time also. So, and I'm very happy that the cornea department has flourished so well, has become so great and expanded so very well. And I congratulate everyone for who has contributed towards this. And thank you very much. It has been a great experience working in SANKARA NETHRALAYA. All our lives have started there and will continue to be there all along. Thank you very much. Thank you, Sujata.
Thank you, Dr. MK. We'll now listen to vitreous services now, and no other than Dr. Lingam Gopal will talk about the vitreous services of our department, of our SANKARA NETHRALAYA. He is the teacher of the teachers and a great student of Dr. S.S. Badrinath.
Slideshow, where is slideshow? At the outset, I would like to thank Dr. Sujata and Dr. Biswas for asking me to talk about the vitreoretinal services. Let me just get the slideshow on. Give me a second. Yeah, you can see my slide now.
Yes.
Well, I would like to pay homage to Dr. S.S. Badrinath, my teacher and mentor, and a teacher for all of us that have gathered today. He is the Bhagwan of vitreoretinal services, and he started the Sri Bhagwan Mahavir vitreoretinal services. He started after his training was imparted by Dr. Charles Keepens, and with the blessings of Sankaracharya, SankaNethralaya. No doubt he started SankaNethralaya, but SankaNethralaya initially was synonymous with vitreoretinal surgery because that's what he was trained in, and the bulk of the workload was vitreoretinal when it started off. Subsequently, of course, he added other specialties, but I'll be talking briefly about the vitreoretinal service and how it started. In addition to Dr. Badrinath, the stalwarts who built this department along with him were Dr. Babu Rajendran, who worked briefly at SankaNethralaya, and then he went off on his own to Vijaya Hospital. It's Dr. Chandran Abraham, Dr. Mary Abraham, and Dr. Manju Kulkarni, who actually used to wear two hats, one of cornea and another of vitreoretinal services. They were the stalwarts, along with Dr. Badrinath, who built the vitreoretinal services, be it scleral buckling, be it photocoagulation, ultrasonography, electrodiagnostics, etc. So at the forefront, SankaNethralaya was in equipping the department with state-of-art equipment that was required. We understand that vitreoretinal services literally grew with SankaNethralaya because vitrectomy itself was started by Makamar only around the time that SankaNethralaya was born. So the first 3-port vitrectomy machine called the Accutome system, invented by Conor O'Malley, was purchased at SankaNethralaya in India. And subsequent to that, we have seen a plethora of instruments which have come as after the Accutome system. We also were the first to acquire the organ laser machine, which was a huge machine, and Dr. Chandra Abraham was so popular with performing these laser photocoagulations that his photocoagulation list used to go on until 11 o'clock in the night. We were also the first people to bring in the ultrasonography machine and the UBM, as well as electrodiagnostic facilities to India. So what stood out about the vitreoretinal practice at SankaNethralaya was the meticulousness to detail, an absolute no to any compromise, and innovativeness. These were the foundations which were established by our mentor, Dr. Badrinath, and followed subsequently by everybody who worked in this department. I'd like to show you the picture to the left, which was the standard retinal drawing, which was an absolute must before any retinal detachment surgery was performed. And this was signed and countersigned by the surgeon. You can see the signature of Dr. Badrinath. And you can also see on the back of this page how the drawing of the implant was made with each suture clearly demarcated, so that if the patient has to undergo a buccal removal, we are very much knowledgeable about where to find the sutures. Also, I would like to bring your attention to this innovativeness of Dr. Badrinath, wherein this is the pre-perfluorocarbon liquid era, where we did not have the neurosurgical table, the Stryker's table, but he innovated along with Dr. Ayan Sundaraj to tie up a patient to a trolley, turn the patient upside down, and perform a surgery for giant retinal tear with retinal detachment. SankaNethralaya spawned dozens of mini Netralayas across the country by the commitment to quality, training, and teaching. You already heard about various institutes that have been built, and they in turn are able to train more people. And now we have got a wide alumnus all over this country as well as in Asia. So with these few words, I would like to hand you over to Dr. Muna Bende, the current head of the Department of Vitreoretinal Services, for the update on the achievements of the departments over time. Thank you very much.
Dr. Muna, we are not able to hear you.
Muna,
You're
unmute
muted.
you. Muna, unmute it.
Dr. Muna, we are not
Yeah,
able to hear
yeah,
you.
yeah.
Okay, start from the beginning.
Yes. It's an honor for me to speak about the Department of Vitreoretinal Services, being the favorite child of our founder and chief, Dr. Badrinath, whom we remember every day. The directors of the department, Dr. Lingam Gopal, we are fortunate is still here to guide us. Dr. Tarun Sharma, who guides us from America now, and Dr. Pramod, who is still in the department. And they built up such a strong department, so well known all over the world, that it's a real challenge for us to follow it. So Dr. Dhanashri and myself now lead a team of consultants, both Chennai and Kolkata. Our Chennai team is a large one comprising 18 consultants. About half are senior consultants with over 20 years of experience, which is unmatched at any center in the country. We have a very talented and enthusiastic junior faculty. We are supported by an experienced anesthesia team, dedicated and skilled nursing personnel, our multilingual patient services, our photographers, our optometrists, and our bio and medical engineers who maintain our state-of-the-art equipment, and not to miss our world-class basic science support. We run outpatient in 2 centers, the main campus, the Dr. Badrinath campus, and the JKCN campus on Dr. Badrinath Road, and operate in theaters in the Dr. Badrinath on the JKCN campus. We saw around 132,948 outpatients in the year 2025, about 10,000 surgeries, of which 2,000 were free, and 5,000 intravitreal injections. And this is our department on the 7th floor of the Dr. Badrinath main campus. Here we see a red cam image being taken of a child with retinopathy of prematurity and the state-of-the-art vitrectomy machines with the Ingenuity system. Our strengths are our clinical work. We are probably one of the leading centers in ROP surgery in this part of the world. And we have 4 experienced vitreoretinal surgeons who operate these cases. We've done 420 surgeries in 2025 and screened in the outpatient 1,320 babies, aside from NICUs all over the city. Pediatric retina is also a strong point. The oncology services were given a fillip by Dr. Mahesh, who's going to follow me today. And right now we have Dr. Subaneshwari, who heads the oncology service. We saw 54 new retinoblastoma cases in 2025, and we have about 150 on continued follow-up. Another strong point is the trauma and emergency services, which run 24/7 around the year, with a faculty member, a consultant, and a senior resident available around the clock. We also specialize in surgeries for myopic traction maculopathy, especially macular buckles, complex cases straddling subspecialties like ocular surface, glaucoma, and pediatrics. We have a strong interest in inherited retinal dystrophies with support from our genetics team, and genetic testing is routine every day in our department. We have referrals from all over India and a large number of international patients, many from neighboring countries. And despite political upheavals, we had about 2,500 patients seen in the last year with 624 surgeries performed. What is again our USP is, as far as retina work is concerned, there's absolutely no discrimination between free and paying surgeries. Academics is our strong point. Apart from our routine teaching and training that happens, we are proud to say we have the vitreoretinal surgery simulator where we directly supervise our fellows. before they perform complex tasks on patients. We have our wet labs where students are taught to perform injections. Here you see Ozurdex wet lab in progress. I'm proud to say we have almost 500 vitreoretinal fellows since 1979, in addition to other newer fellowships. Our research focus are many, starting with Dr. Gopal and coloboma choroid, and our large epidemiological NAI projects on diabetic retinopathy, in addition to other interests as well. And we've had 75 peer-reviewed publications from April 2024 to March 2025, and we're still counting. And Shankar Nethralaya is proud to have transformed diabetic retinopathy care in the country under the leadership of Dr. Tarun Sharma and Dr. Rajiv Raman, who, though they are no longer in Nethralaya, continue to guide us every day. We have done multiple multicentric trials, 32 clinical trials since 2009, 3 going on right now, 1 awaiting enrollment, which is going to be a landmark trial, and numerous research projects with a basic science section. The awards and recognitions over the years have been numerous. For shortage of time, I've only confined myself to 2025, and I'm sure there are more to come. We conduct a very popular theme-based retina summit, which is now going to have its 8th meeting this year. We conduct awareness programs for diabetes, retinoblastoma, and retinopathy of prematurity on the designated dates every year. And we've also conducted 3 webinars, which have a link between basic and clinical sciences on angiogenesis, atrophy, and fibrosis, which were of very high quality and much appreciated. So this was just a short outline of our retina services as it stands now. I'll now pass you on to Dr. Mahesh. Thank you, everyone, for this opportunity.
Thank you, Munna. Thank you, Dr. Sujata, Dr. JB, and the TNOA. It's indeed a pleasure to speak about Shankar Nethralaya. We have been hearing about the wonderful work being done by each of the departments, but Shankar Nethralaya is not Shankar Nethralaya because of all this work, but in the principles and ethics of the founder. So that's what has been in my DNA, ingrained in my DNA. So some of the principles which Dr. Badrinath taught us was not to belie the trust placed in one by the patient. Never ever belie the trust. So that's something which is ingrained in me. And in addition, we learn about the discipline, owning up one's responsibility and standing up to it, punctuality, humility, respect for fellow professionals. These are the ethics which were ingrained in us, which made Shankar Nethralaya what it is today and made us all as to what it was or what it is right now. Of course, been blessed to be trained by stalwarts like Dr. Badrinath, Dr. Gopal, Dr. Tarun, and all those people. Thanks to all of them. So, oncology department was started by us. Like I remember way back in 1994 when I was invited for when I was my abstract was like accepted for a presentation in international meeting. We usually go around identifying some international centers we would want to go and spend some time observing the stalwart surgeons abroad. So when I went and gave him a list of the centers I would wish to visit when I went to the US, he just looked at it, put it aside, and said, like, why don't you go do oncology? So that's how it started. And we wrote to Dr. Shields, and then they accepted it and went over for an observation for about 4 to 5 weeks. And we came back and we were the first to start in the country the intravenous chemotherapy for retinoblastoma, the transpupillary thermotherapy, brachytherapy. And brachytherapy was something which was very, very expensive to start by importing the seeds. So Dr. Badrinath insisted that we make our own seeds. So he put me on to the BARC. And nearly for about 7 years, I used to go nearly twice a year to BARC to make those iodine 125 seeds indigenously. And we at Shankar Nethralaya were the first people to start brachytherapy in India. So the many firsts in ocular oncology, and the ocular oncology department itself was started purely because of Dr. Badrinath's vision and foresight. So that's what made Shankar Nethralaya what it is rather. So I'm thankful to him and thankful to all my mentors. And thank you, Dr. Sujata, once again for the opportunity.
Thanks, Dr. Magesh, and thanks to Dr. LG and Dr. Mona Bende for giving such an inspiring talk. And now we'll move on to the glaucoma department. Before I ask Dr. LV to speak, I'd like to remember Dr. Sridhar Rao, who was our teacher in glaucoma when we joined as postgraduates. No, he's no longer with us. I think it was a great inspiration to all of us. And that was one of the reasons why I liked glaucoma so much. Thank you. Over to Dr. Vijaya, please.
Am I audible?
Yes. Yeah, you're audible, yes.
Yeah. At the outset, like to thank TNOA, especially Dr. Sujata, for a wonderful opportunity and bringing us all together. So I will be talking initially about glaucoma as a subspecialty, and Dr. Bhaskar will follow me. And Chief has a vision, even in the initial stages, even though it was known as a vitreoretinal center, the importance of starting all the subspecialties. She has identified all the subspecialties, insisted we should start these departments and develop these departments. In the initial almost 5 to 10 years, the only fellowship offered at Shankar Nethralaya was the vitreoretinal services. All of us who were trained at that time are all trained vitreoretinal surgeons. And he used to identify the others for the other departments, the good candidates from these trained people, and encouraged people to take these subspecialties. And one subspecialty, such one is the glaucoma services. It was started by Dr. Ram, whom I have never met. And by the time I came, and it was Dr. Sridhar Rao who was the one who started the department. All these subspecialties have followed the main objectives of the Shankar Nethralaya, that is providing the quality eye care to all people irrespective of the affordability, and teaching and training, which is an important part of the Shankar Nethralaya, and carrying out India-centric research. So Dr. Sridhar Rao was identified, and the glaucoma services were started in 1981. Dr. Badri has encouraged, like Dr. MK has said, asked him to go to the Boston and have the formal training for the glaucoma services. At a later date, he also was sent to the Alcan laboratories in USA to get trained in clinical research. So he started the clinical research at Shankar Nethralaya. Dr. Sridhar Rao single-handedly has started the department and paved the way for the expansion of the department. And one consultant department has become a huge department now, and for many years we are more than 10 to 12 consultants in the department. Many people after the training worked with us at Shankar Nethralaya and served the Nethralaya, and for various reasons they have left. Nethralaya like to thank them always for the services they have rendered, and also for providing the glaucoma care in the other parts of the country and the world. The glaucoma department is known as Srimati Jadabai Natmal Singhi Glaucoma Services. It was donated by our board member, Mr. Sugalchand Jain, and it is named after his mother. Initially, it was in the old building almost for 10 to 12 years. In 92, it was shifted to the Mexico block at second floor. For almost 30 years, it was in the same place, and recently we moved one floor above with the new facilities. Bhaskar will be talking about it. And we provide the latest technology in the diagnosis and management of the glaucoma, and we have all the cutting edge technology available with us. We not only provide these services, we are also part of collecting the normative data for many of these equipment listed here over the years. And education is an important. In 1990, we have started the fellowship program, and it is not as popular as we are, but we do have good number of fellows trained from glaucoma services. More than 100 have been trained. And many of them are from practicing in different parts of the India and also across the world. You can see that in the map here. Coming to the, if you look at the Glaucoma Society of India program every year, many of the faculty in the society meeting are all the people trained from Shankar Nethralaya. It's really proud to see so many of them so well in and providing the glaucoma care across the world. This is one of the photographs taken during that one of the Glaucoma Society meetings in Mumbai. You can see the number of the trained glaucoma fellows from Shankar Nethralaya. And research is a part and parcel of all the subspecialties in Shankar Nethralaya. We have done a lot of research in the last 38 to 40 years, or maybe a little more than that. And that will be in terms of the drug trials and the clinical research and basic science research. The one research I like to emphasize here is the time, almost a decade, we had done the epidemiological study of the glaucoma, and the entire all the three studies under this epidemiological studies are supported by Chennai Wellington Corporate Foundation, and special thanks to Mr. Narayanan, who was the key member of the board of the Chennai Wellington Corporation. In view of the research, what we do have a lot of collaboration with the premier institutes, not only in the country and across the world. So we are able to do more research because of the good quality research being done in the glaucoma care. To sum up, if you want to say that we do follow all the three principles of Shankar Nethralaya in terms of the patient care, education, and research, and I will be handing over to Dr. Bhaskaran for further information about Shankar Nethralaya. Thank you.
Thank you, ma'am. I would like to elaborate a little bit on the department to begin with. Of course, with Dr. Vijaya and Dr. Shanta's help till even today, if we knock on their doors, they answer to us and give clarity to any difficult patient. And of course, due to their graciousness, we are able to take over the leadership as juniors, and we are taking it forward. Now, this is the department members in Shankar Nethralaya main, and it is ever expanding. 14 of us here and 5 more in Shankar Nethralaya Kolkata branch. Thanks to the ICICI Foundation, we have this new floor, which is completely done and catering to the patients, both the free and the paying sections together. Of course, Dr. Vijaya has elaborated about the latest equipments available in the glaucoma department. We have 14 consultants here, and the optometrists supporting are 12, and patients seen are between 20 to 25,000 a year, and 22,500 to 3,000 glaucoma surgeries are done, apart from the typical glaucoma cases that come up with the glaucoma department. And 150 to 200 children are operated in the glaucoma services. And we do regular genetic counseling and genetic tests nowadays, and we are increasing the numbers due to the newer information available on these. And we have a very close tie-up with the low vision clinic helping patients rehab as well. And we do complex surgeries, newer advances, including the mixed procedures, all of them which are available in India. And we also do the complex surgeries with the vitreoretina procedures, as well as the corneal K-Pro, OKP related glaucomas, and the valved and non-valved implants that we do as well. And we keep training the fellows in the wet lab. And we, Dr. Vijaya has alluded to the fellows and their, spanning across the countries. And of course, we also have PhDs, MPhil, MOptoms who do research under us. And these optometrists are also trained in the glaucoma services. And some of their gonioscopies are much better than even the fellows that we train, actually. And they are really good at it. And of course, they have been publishing a lot and innovating a lot as well with these collaborations. And of course, the top 2% global scientists, Elsevier, Stanford, we have our faculty, we are proud to say that. And 30 to 50 publications a year are coming from the glaucoma department, that is regularly for the last 10 to 15 years. of course, from the Chennai glaucoma study, follow-up study. We're also part of the Google project, basic science research spanning genetics, nanotech, biochemistry. We have been publishing. And we also conduct CME programs, and we contribute to the national and international conferences. We are proud to conduct the international conference CGIG in 2006. And we had president and secretary in the GSI. And of course, we were part of the glaucoma guidelines, both nationally and internationally. And what future holds for glaucoma, we want to concentrate on prevention strategies like family screening programs and the awareness programs, and scaling the genetic analysis in glaucoma, supporting clinical and translational research in glaucoma, not only with us, but also with our alumnus, upscaling fellowship and PG glaucoma programs. And we conduct this SANKARA NETHRALAYA glaucoma practice tenets, which is becoming popular. Of course, never waver from the patient-centric approach and the individual care. Thank you very much for the opportunity.
Thank you, Dr. Vijaya and Dr. Bhaskar, for this overview about the glaucoma department. The numbers are mind-boggling, and really appreciate the effort taken by the team. Now we'll move on to the next department, Department of Uvea, by Dr. JB.
Thank you, Dr. Sujata. Am I audible?
Yes, you're audible.
Uveitis is an enigmatic disease, and in this, it's not as common as glaucoma or vitreoretinal diseases, but it's an enigmatic disease, and Dr. Badrinath envisioned that long time back that there should be a separate department for the uveitis. The origin of the uvea department started in as early as 1983, one of the oldest uvea department in the country. It was conceptualized by Dr. S.S. Badrinath and first started by Dr. Rajnikanta, who was with us for several years. And then after that, I took over and led the department for many years. And now Dr. Sudha Ganesh is the chief of director of the uvea department. And we have got 12 consultants in one of the largest uvea department in the world, actually. We have done the pioneering program and the registries, established the first uveitis registry in India, launched India's long-term uveitis fellowship program, first to describe uveitis pattern across the India. The pattern of uveitis in India was first described by us. It's developed comprehensive laboratory investigation packages in uveitis, introduced the use of several new immunomodulatory agents and biologics like mycophenolate mofetil and JAK inhibitors, integrated quantiferon TB gold test in the uveitis diagnosis, particularly to find out tuberculosis. Conducted a pioneering study on ocular morbidity in active systemic tuberculosis, which was brainchild of Dr. Badrinath. Described the ocular lesions in AIDS first time in the country, and also described the largest series of ocular lesions in AIDS in India. Established clinical pathological correlation and ocular tuberculosis, advanced the role of high-resolution CT chest scan in uveitis by Dr. Sudha Ganesh, and Neves disease, analyzed the serum angiotensin converting enzyme with the help of biochemistry department in sarcoid uveitis. We have described the clinical features of the several uveitic entities like HIV, TB, sarcoidosis, VKH, SLE, syphilis, Wegener's granulomatosis, tubercular intermediate tubercular uveitis, and also many other conditions. We have completed about 25 research projects, of which one of them was very popular, the 0.2 milligram per day fluocinolone, which is now available in the market. We also the first to introduce the dexamethasone implant Aududex in uveitis. Ongoing research project, we are doing the ShankaraNethralaya tubercular uveitis study, a multinational study, and also we organized the first international uveitis study group meeting in India in 2001, which was supported by Dr. Badrinath. And we have got the four of us are international uveitis study group member, Dr. Sudha Dr. Sudarshan and Dr. Pathotim along with me. Top 5, we have got several publications which has got more than 200 citations. Is an update, current approaches in the diagnosis and management of anterior uveitis, pattern of uveitis in India, in uveitis clinic in India, polymerase chain reaction with Dr. Madhavan, Professor Madhavan, in the epiretinal membrane in Hill's disease, and intraocular tuberculosis clinical pathological correlations. We have got 5 books on uveitis and ophthalmic pathology. There are several publications which you have heard in various 300 plus peer-reviewed publications, and each subject we have got publications for 50 or more. And you can see the citations of each year, which is increasing. And we see about 3,000 patients per year in uvea clinic as the new cases. And there are several awards which you have received is that over the years, Horia Masam Award, P. Shivareddy Award, Dr. G. Venkateswamy Oration Award, myself and Dr. Sudha Ganesh, and Dr. Joseph Garadikam Award. I was got the Lifetime Achievement Award for my work on uveitis, and also the International Award, Dr. David Benez Award by International Ophthalmic Inflammation Society. 2 of our consultants is the top 2 scientists in the Stanford list. And we have pioneered uveitis fellowship in India from India and abroad, and have got more than 100 observers from India and abroad who have stayed with our department and participated in the management and learned the techniques. We have got a very well-supported laboratory, biochemistry, pathology, microbiology, genetics, molecular biology, who not only helps in the clinical work, but also our research support. We have got several diagnostic facility, wide field fundus photography with Optos, wide field photography with the Claras, digital fundus fluorescence angiogram, indocyanine green angiogram, wide angle photography, UVM, ultrasound, and optical coherence tomography and optical coherence tomographic angiography. That we have got phacoemulsification for routine and uveitis complicated cataract, intravitreal injections, periocular injection, vitreoretinal surgery complex, and we are well supported by a good vitreoretinal department. We do the laser photocoagulation for Hill's disease and other retinal vascular diseases. Intraocular biopsy is done, aqueous and vitreous, and even subretinal biopsy is done. What research we are doing now? We are doing SSOCTA, the exercise optical coherence tomography in retinal vasculitis, and we are demonstrating the vascular changes as well as the macular changes in the retina. We are doing that biologic agents, application of biologic agents, and we are first to publish the last series of patients with a new therapy or biologic therapy called TNF alpha inhibitors, JAK inhibitors, etc. And this is the anti-tumor necrosis factor alpha agent in management of HLA-B27 positive anti-uveitis, Janus kinase inhibitors in scleritis, and also new in management of infectious uveitis. We are giving intravitreal bevacizumab and intravitreal moxifloxacin. And this is a case of intraocular tuberculosis of a patient who had spinal tuberculosis after intravitreal moxifloxacin and bevacizumab is subsided. We are doing in the research front for cytometry of T-regulatory cells in presumed tubercular uveitis and single nucleotide polymorphism analysis in the disease of sarcoid uveitis basis and VKH. This is our team we are 12 members, including Calcutta branch. And I like to end with a quotation: the known is finite, unknown is infinite. Intellectually, we stand on an islet in the midst of ocean of inexplicability. Our business in every generation is to reclaim a little more land. We in the UVR department, we follow and try to understand, try to reclaim a little more land in the ocean of inexplicability. Thank you very much.
Thank you, Dr. JB. I request Dr. Aki ma'am to say a few words and her comments and her experience at Shankar Nethralaya.
She only started the department.
Thank you very much, Dr. Sujata and Dr. Biswas and all other consultants. Thank you very much for inviting me to say a few words in this program. And I joined Shankara Nethralaya in 1982 as a VR fellow, vitreoretinal fellow, not a uveitis fellow. And am I audible?
Yeah,
Yes.
you're audible, ma'am. Yeah.
Okay, thank you. And that those days the VR fellowship used to be 1 year. So I joined in 1982, and when I was completing it, Dr. Badrinath sir asked me, Rajni, you're going to complete the VR fellowship. What are your plans? I said, sir, I would like to continue in this institution. He said, why don't you start the uveitis department? So that is how the department was started. Before that, everyone used to see uveitis patients, all consultants. They were all very good. They could treat very well. But the department started in 1983, and I maintained a small register, a simple register with the name of the patient, with the MRD number and the diagnosis, and that was enough for me, so that if I had to present a paper, I will know how many toxoplasmosis was there, and how many toxocara was there, how many pars planitis was there. So that is how it started. And of course, doing VR fellowship helps a lot in uveitis, because we do this fundus examination with the indirect binocular indirect ophthalmoscope, and every patient we indent and see the pars plana. So once you have done that, you can never miss a pars plana. It is snow banking of the pars plana. You cannot miss. So that's how, in a very simple way, it started. And I'm so happy Dr. Biswas could carry it. What started as a small plant, it was a very small plant. It became a big banyan tree thanks to Dr. Biswas and everyone in the uveitis department. So I thank you all once again for giving me this opportunity. Of course, we had a very good, excellent laboratory even those days. Even if you make a clinical diagnosis, we have to confirm it with a lab support. So that was excellent. Even those days, it was very good. Of course, it has expanded into a very big thing now. So once again, I thank Sujata and Dr. JB for having given me this opportunity. Thank you very much.
Ma'am, we are still maintaining the register.
Thank you, Dr. JB and Dr. RK, ma'am. I think we'll go on to the pediatric department by Dr. Sumita Garkar. Dr. Sumita? No, I'm sorry. I think, no, I just jumped it.
Yeah, I thought it was.
Sorry,
Sumita. Yeah, no problem, no problem. I'm ready.
No, Dr. NS.
NS is going to do. Oh, okay.
NS.
I was thinking, I was after NS and I was a little.
You're right. Sorry, ma'am.
Shall I play now?
Yes, ma'am.
Past, present, and future of oculoplastic surgery. Way back in 1981, I had an injury to the cornea. I went to see Dr. SSP. After treating me, he said whether I would help him in starting orbital surgery at Shankara Nethralaya. I was stunned. I told him that I do not know anything about orbit. So what? He said, we will learn it together. The next day, he referred a case of neurofibroma of the orbit. I did a debulking with good result, and this started my love affair with oculoplastic surgery. The roots of reconstructive periocular surgery can be traced to ancient India. Sushruta, an ancient physician and surgeon, made significant contributions in the field of plastic and cataract surgery. He described reconstructive techniques for facial structures. In his book, he described various methods, including skin graft, rotation flap, pedicle graft, and reconstruction of nose was described in detail. The two world wars brought attention to injuries around the periorbital structures. Sutures were taken to attach eyelids to brows to correct doses of eyelids. Sir Harold Gillis is credited as father of plastic surgery. In India, Dr. Balakrishnan and Dr. Antya helped in developing reconstruction of congenital anomalies and injuries around the face. Innovation means creating new ideas, methods, solutions, which promote improvement in the final outcome. This is well utilized in today's management of reconstruction of eyelids and periorbital areas. Modern oculoplastic surgery stands today as a highly refined subspecialty addressing eyelid and adnexal reconstruction, orbital disorders, benign and malignant tumors in orbit, lacrimal system surgery, trauma management, functional and aesthetic periocular surgery. With microsurgical tools, high resolution imaging, endoscopic approaches, multidisciplinary help, the oculoplastic surgeon restores not only the missing parts but also restores the confidence in the individual. Upper eyelid coloboma repaired, upper eyelid coloboma repaired with a switch flap from the lower eyelid, levator resection in a young person, tessier cleft number 4 on the left side, which is corrected along with the lip repair. This is classified as a tessier cleft 4, but would it be a sequelae due to amniotic gland? Scar revision and eyelid reconstructions were done. Child had postcanal atresia, which was also corrected. Congenital anomalies, which looks so terrible when the child is born, but can be corrected very well. Congenital microphthalmos in a neonate, it was shrunken orbit, which could be expanded by using a dumbbell-shaped expander. And finally, we could put in an eye shell to the socket. Post-retinoblastoma contracted socket, which was corrected by a free flap. And here you can see after the custom-made prosthesis has been given to the patient. Injury producing terrible deformity, which can be corrected with. Incomplete cryptophthalmos can be corrected by the oculoplastic surgeon, and orbital lymphangioma can be removed by the anterior orbitotomy. And here you can see the child 9 months after. Tomorrow, looking ahead, future promises transformative advances, robotic microsurgical assistance, AI-guided surgical planning, 3D printed orbital implant, biointegrated implants, tissue engineering, and minimally invasive aesthetic procedures. Sarve bhavantu sukhinaha. May all beings be happy, healthy, and free from suffering. Oculoplastic surgery is not merely about correcting defects. It is about restoring light, function, and confidence.
Thank you, ma'am. That was really wonderful. As one of the PGs who have seen you operate, you're a fantastic surgeon, and we all know that you continue to operate even now. And it was a very inspiring speech. Thanks a lot for the participation, ma'am. Now we'll go on to the next department, pediatric department by Dr. Sumita.
Good evening, everyone. Am I audible?
Yeah, you are audible.
Yes.
Yeah.
So let me start sharing my slides. So this presentation, I and my Deputy Director, Dr. Kavita, we are both going to do it. And let's look at it, managing childhood eye problems. Ours is a small department, but really takes care of big problems. So it was probably first.
Shumita, can you make it full screen?
Full screen. Okay, sir. 1 second, sir. Better?
Yeah.
Yeah, so it was one of the first independent department after veterinary department, probably in Nethralaya, much before the pediatric ophthalmology became the in thing. And Dr. TSS at that time was one-man army, setting up the department, taking care of children, contact lens fittings, teaching students and optoms, till he was joined by Dr. KRS. These three gentlemen here have an indirect effort on indirect effect on our department, Dr. Marshall Parks, Dr. Art Jampolaski, and Dr. Prem Prakash. They are all doyens of strabismus, and because they were mentors of Dr. TSS, we feel that they have some indirect contact with us. So by 90s, department had expanded to around 5 consultants. This is some of the pictures of Dr. TSS enjoying his time in Washington and in Massachusetts during his training years. So initially it was a squint department, and more or less the only surgeries and only procedures were strabismus and amblyopia. But the shift to pediatric ophthalmology was seamless, holistic, and in sync with the times. Department started catering to the children with different needs. The profile of children coming to the hospital also changed. It required multidisciplinary approach. We needed to work with a lot with the glaucoma department and vitreoretinal department because the nature of the patients changed as we. So department services also expanded to include many special services which were not there in the initial part of the department, in the initial part of our years. A special mention here for Dr. Meenakshi Swaminathan, who with her training in US and her very enthusiastic approach, who set up many of the protocols of workup and pediatric exam in our hospital. And she was the one who brought a structure to our fellowship training. So I think a big shout out to Dr. Meenakshi if she's listening here. This is a way to express our gratitude for whatever she has done over 20 years with SN. Orbis collaboration in Shankar Nethralaya led to the pediatric ophthalmology department being labeled as a learning and training center in 2002. And for next 10 or 12 years, we trained fellows on behalf of Orbis. And after that, it became a Shankar Nethralaya fellowship, and we continued doing the good work. So this is a department over the years. As you can see, people have come and gone, and we express our gratitude to all the people who have been part of this journey in various times. I'm missing Dr. Sriram Ramalingam, Dr. Sandeep Tirumalai, and Dr. Mutumina here because I couldn't get the pictures. But wherever the department has been, Dr. TSS has been central to our existence, as you can see in all the pictures. So this is the current crop of 6 consultants which we have now. Last year we got a generous endowment from Mr. Shankar, chairman of Sanmar Group, and we got a much needed facelift to our department in the 5th floor. And I'm happy to note that all the artwork which you see here in these pictures was done by consultants in Nethralaya and Dr. Ravi Shankar's daughter, Indu. So, like envisioned by Chief everywhere, pillars of our department remain patient care, which is done by 6 full-time consultants. We see a wide spectrum of patients. Some of them we manage with other we co-manage with other subspecialties. And I would like to acknowledge the invaluable support which is extended by the Department of Optometry here. They make us look good in many, many, many ways. Our other second pillar of our thing is also research in form of many prospective and retrospective studies, publications, presentations, invited lectures and symposia. And we also have education as our third pillar, where education consists of postgraduate education, clinical fellows, optometry fellowship, and also teaching elite school of optometry students. So this is all accomplished by clinicians seen here, a large team of pediatric optometrists seen here, and the secretarial staff which is seen here. Without any of these, our department will fall flat on its face. So these are some of the statistics. We took care of almost 57,000 patients last year. We performed around 3,976 different procedures, and we saw several other patients in our specialty clinics in the hospital. And this is how a regular day in pediatric ophthalmology looks like. You can see it's challenging as well as fun, and it can be sometimes really, really frustrating, but also very, very, very gratifying. And to continue further, I'm going to request Dr. Kavita, who is my deputy and is going to be the future of pediatric ophthalmology in Nethralaya, to carry over about what we think should be our future in the next. Over to you, Kavita.
Thank you so much, ma'am. And I'm so happy to be part of the department for the last 20 years. I was a student as well as now I'm a faculty, and I'm now standing side by side with Dr. Sumita, ma'am. Ma'am, continue the slides.
Okay, just tell me when to move it. I will do it.
Yeah. You can now. So in continuation, like we said, our pediatric ophthalmology department we have multiple allied departments like the binocular vision and orthoptics clinic. We have a myopia clinic, which is full-fledged, one of the kind in the country. We have a full-fledged amblyopia clinic. We have pediatric low vision service. Our contact lens department was established by Dr. TSS, and for a very long time, it was part of the pediatric ophthalmology department. Now it is extended to other specialties as well. And we have a special children clinic where we take care of children with special needs. And we have a little extended center for vision enhancement where we assess children with special needs and we give therapy as well. Next slide. So we are part of school screening program. We have a robust school screening program associated with the Elite School of Optometry, where screening both in urban and suburban schools we have been part of. Training school teachers as well as students were part of this program, and several innovations have come out of this program, making school screening easier and faster. So our ESO team, through the school screening program, have come up with all these elaborate instruments which are very, very essential and helpful for school screening and other on outreach screening programs as well. So Shankar Nethralaya was part of the Orbis for the past 12 to 14 years, like Dr. Smita has said. And through this program in the school, we have been able to train and screen so many children and pick up issues in the children's eyes when they cannot reach the center, where we have been able to treat them with giving free glasses and bringing them to the hospital whenever they needed extended care like surgeries, which were all performed free of cost. So in research, more than 120 publications have come out in the last decade from our department through consultants, optometrists, and fellows in peer-reviewed journals. We have chaptered 30 books chapters, and they have contributions to the Ready Reckoners in AOS as well. We are part of multicentric studies like atom study in India, etc. And for education, we offer an 18-month fellowship program with some exposure in oculoplasty and neuro-ophthalmology as part of the fellowship. We take 2 fellows every 6 months and train them. More than 130 fellows are trained so far in pediatric ophthalmology department of Shankar Nethralaya, and we are proud of that. We also train full-fledged pediatric optometry, and more than 100 students have come out of it, and they're all world over doing very good work. And residents are part of teaching and training as well. What our training program involves in OPD observations in the initial period, and then they move on to pediatric refractions and strabismus hands-on evaluations and workups. And then finally, they do independent OPDs at the SR period. Surgical training involves observation and assisting from day 1, especially strabismus, and then they go on to supervised surgeries and independent surgeries by the end of the fellowship. And adult cataract training as well as pediatric cataract training and trauma surgeries are part of the training program. So what lies ahead for our department is we are planning an eye movement lab with an nystagmus-based workshop. And then we are planning to set up a full-fledged ocular genetic clinic and a new state-of-the-art equipments like digital HES, etc. are in the offing. And we are also expanding our services in our other locations such as Gindi and Agastya, Shankar Nethralaya. With this, I thank Dr. Sujata Mohan ma'am for this opportunity. Thank you.
Thank you, Dr. Sumita and Dr. Kavita. The stupendous work done by the Pediatric Ophthalmology Department under the guidance of TSS is very well known, and he continues to inspire all of us. Now we move on to the next department, Neuro-Ophthalmology Department, and speech to be given by Dr. Ambika.
Yes, sir. Should we take comment from Dr. KRS?
Oh, yeah, I'm sorry. I just missed. I'm sorry, sir. Definitely we should take comments from Dr. KRS. Dr.
Yes.
Kera, sir.
Yes, sir.
Sir, Dr. Ravi?
Yeah,
Yes, sir. Sorry, sir. Sorry, I jumped this queue.
no problem, no problem. I've always been a gentleman. Okay, so I think I'll tell you my story. I've never been in one department. So I joined in 1981, and I was a resident in Delhi along with Dr. Sridhar and Prema. And they were the ones who sort of ignited me to apply for a fellowship program. And the chief called me. Chief is always he's always chief to all of us. Chief called me for an interview, and then just after 5 minutes or so, he said, "Okay, you can come and join after 6 months." So I readily accepted, and then I joined as a raw fellow in vitreoretinal surgery. And those days, I think Chief was just beginning to upgrade his practice from single practice to few consultants. And then, obviously, he is being a visionary. He was well ahead of the times. He started thinking of the three tenets of Nethralaya, what is known for now: patient care, academics, and research. And slowly, each one of the tenants fell in place. And as the fellows kept coming in, so he had a knack of identifying fellows to do uh, uh, to start a department, a subspecialty. That is how all the subspecialties got the consultants, and he built the organization. And then side by side, the education element also came in, and he that was the time when the DNB came. That was very beginning of the DNB program, which started by the national board. Then he asked me, "Why didn't you do that?" I said, I was readily agreed, and then I was one of the first fellows to do a DNB. And since being a vitreoretinal fellow, and Dr. Chandran and Dr. Mary were the only ones who were doing lasers, and they were overloaded, and he asked me to join and help them. So I readily agreed, and then I was sort of under the tutelage of Dr. Chandran and Mary for a while, and started practicing medical retina because of my vitreoretinal fellowship background. Then after a while, I think Dr. Surendran had just come from RP Center, and then he was, as I said, one-man army, and then he said, "Why don't you help him?" So I joined that also. And then slowly the chief, being a visionary, he not only developed the ophthalmic subspecialty, so he wanted to develop ophthalmic care. So that was the one where he started the paramedical programs like optometry, ophthalmic nursing, and then basic sciences program. And then he wanted me to get involved in all this. And then I was very deeply involved in the starting of the optometry school, the ophthalmic nursing program as such. Side by side, I was also deeply involved with the academics when SN started the DO program, the DNB program, etc. Around the year 1989-90, and a team from UK had come, wanted to visit Nethralaya, and then they were impressed by our setup. They said, "Why didn't you have an FRCS?" So again, I think I was one of the person who to have been picked up for the coordinating all the activities of the FRCS, and that was how it started. And slowly, I think SN is the center for the FRCS exam, for the Edinburgh exam. So slowly, I think the academics also fell in place, and all the departments were working in full strength. And I'll never forget the time I had in Nethralaya. I spent almost about 25 years. And the ethos, the effect of chief on all of us is there to be seen. And we'll never forget what he has done to all of us. He is not only a person who is a good clinician, a good administrator, but a great human being. So when I think about chief, especially in those days, you had to think twice before you go and talk to chief. We used to have butterflies. Okay.
Not that he was, but still, we had that awe he created in us, the respect. He commanded respect. He never demanded respect. But now, when you talk about Chief, you get a lump in the throat. And I'm grateful to SN, to Chief especially, and to all my former colleagues who are here with us. I very fondly remember my association with all of them. Thank you.
Thank you. Thank you, sir. Thank you very much.
So now we go on to the neuro-ophthalmology department. Dr. Ambika will be giving her views on it. Dr. Ambika.
Yeah, I'm just sharing my slide. Is it visible?
Still not. Yeah.
Okay. Good evening, everyone. And first of all, let me thank Dr. Sujata and TNOA for this wonderful opportunity on allowing me to share the space with such giants of ophthalmology, my teachers and mentors. Well, I'm going to talk on neuro-ophthalmology department in Shankar Nethralaya, the highlights over 4 decades. So we heard a lot about the ophthalmic subspecialty which are growing in Shankar Nethralaya, but now we are coming into a specialty which deals mostly neurological diseases presenting in ophthalmic symptoms. So neuro-ophthalmology is a highly specialized ophthalmic subspecialty that deals with eye and the CNS as afferent or efferent disorders. And it is quite a challenging field which requires a holistic integration of multiple primary medical specialties starting from neurology, neurosurgery, ENT, and radiology with ophthalmology. So to practice neuro-ophthalmology, a person needs to undergo some amount of training and a comprehensive exposure in neurology, neurosurgery, and neuroradiology, which is quite demanding in an ophthalmic setup. So at this juncture, I like to give my tribute and my thanks to our beloved chief who recognized the requirement of such a specialty in India long ago. And this shows that how much he was thoughtful about the specialty practice in India. So if we come to the evolution of neuro-ophthalmology at SN, it started way back in 1980s, where the foundation was laid by our chief. And in 1990s, it started expanding and people started joining as consultants with international training. And the team grew in 2000 and became a wonderful specialty as such in Shankar Nethralaya. And today, probably we really are happy to share that we are a center of excellence in neuro-ophthalmology and hope to continue and strive the same in the future. So none other than our beloved Dr. Lingam Gopal, who has been a multitasking consultant way back in 1980s, who started this specialty, and he was practicing vitreoretina, uvea, and neuro-ophthalmology that time, along with Dr. J.K. Challa, who was one of the pioneers who was practicing neuro-ophthalmology in Shankar Nethralaya. So Dr. LG did his neuro-ophthalm observership with Dr. Lawton Smith and Dr. Joel Glazer, and he also established this department in Shankar Nethralaya when not many ophthalmic institutions in India had such services. So in 1990s, it is then when Dr. Naveen Jayakumar joined the department, and following his international training with Dr. Neil Miller in Wilmer Eye Institute and Professor William Hoyt, Joel Glazer, and Stephen Felden, he joined and he started steering the department to the promising role of neuro-ophthalmology. And Dr. Satyakarna joined in 1997, who was one of the key persons who laid the protocols and the functioning modalities in the department. And subsequently in 1999, I joined the department after a training with a renowned neurologist, senior neurologist, Dr. G. Arjun Das, and my seniors and teachers in SN. And after the international training with Dr. Andrew Lee, James Goodwin, Joel Glazer, and Norona, I continued to do my neuro-ophthalmic practice. So my presentation will be incomplete if I'm not mentioning this wonderful radiologist, Dr. Veenu Norona, who is with us, and she's the backbone of our neuro-ophthalmic clinical care and practice. Not only neuro-ophthalmology, I think any ophthalmic subspecialty which requires neuroimaging, she's the key person, and she is always ready to help with us. So in 2000s, it is Dr. Padwaja, my great pal. She joined neuro-ophthalmology. She was practicing squint earlier. and Dr. Rashmin, Dr. Smita, and Dr. Shekhar join hands in neuro-ophthalmology. Other than the glaucoma consultants, Dr. Aditya, Dr. Nikhil, who also started practicing neuro-ophthalmology, and a special mention to Dr. Vijay, who was an immense support in the neuro-ophthalmology department, although he practiced squint as a specialty, and Dr. Subhashni, who was trained by us in the field. Although many of them left, Dr. Smita and Shikha and myself continue to strive in the current department as consultants, and we started having young and bright minds joining the neuro-ophthalmology from 2014. And this is the current team, Dr. Durga, Dr. Vidya, Dr. Padma, who all have done an intense neuro-ophthalmology fellowship, a training, and they are doing an excellent work in the department till date. So these are the clinical services what we provide, and we start with wide range of symptoms. It might be a vision loss to field defect or an ocular motility dysfunction. We try to bat a lot of neuro-ophthalmic diseases, right? Be it an optic neuropathy, a malingerer, a demyelination condition, intracranial tumor, myopathies, infiltrative diseases. We have a plethora of conditions which are presenting to us, and we are really thankful to all the neurologists and the neurosurgeons whom I have seen over maybe 3 decades plus are continuing to refer to Shankar Nethralaya for their practice, and that network is very well maintained, and I think that is the reason why the department has grown to this extent, because it will not be possible without their help to maintain this network and continue the patient care. We have a lot of state-of-art equipment which is well maintained in Shankar Nethralaya and which is very useful for our patient care. And with all these services, we have continued to serve not only India, Bangladesh, and the neighboring countries. We have started getting referral from Cape Town, Russia, and so on. So we have immense neuro-ophthal referrals of late. And these are the new neuro-ophthal referrals stats, what I have pulled out from our DPS. It was 2010, it was 15,000 and odd, and now it has grown in 2024 almost to 20,000. So it was again the brainchild of our beloved chief, and you can see senior Dr. G. Arjun Das, who have been instrumental in bringing this neuro-optometry rehab assessment clinic, because that was very needed and that was particularly useful for patients who are having debilitating ophthalmic diseases, particularly post-traumatic brain injuries, cerebrovascular accidents, neurodegenerative disorders. We have a wonderful team of neuro-optometry evaluation, and which is giving a wonderful care for all these patients, and it is useful to many of them of late. And coming to the research and academic contributions, we have more than 180 publications from the department, and we have authored and co-authored multiple chapters, textbooks of ophthalmology as well as neuro-ophthalmology. And we are also conducting pioneer research trials, clinical trials across globe, and we are sharing hands with many global clinical trials. We also started an isolated neuro-ophthal fellowship, which is since 2007, and our program has trained successfully 12 candidates so far. In this neuro-ophthalmology program, a person will not only go through a comprehensive ophthalmology and neuro-ophthalmology training, they also go a referral, and they also go on turn to the neurology, neurosurgery, and radiology training exposure, which I feel that it is not that much given in any other centers. Or maybe the neuro-ophthalmology can be a part of squint or glaucoma or any other subspecialty in most of the teaching institutions. And as I mentioned, we are part of the iconic trials across the globe, like this Nordic trial, which has been a key research trial in the NION study. We have been a part. And according to the Bonsai group, which is one of the premier AI modulating type of research group, Shankar Nethralaya is sharing space with global institutions like SNEC, Emory, and Johns Hopkins. And we are continuing to do this work. And we have a fleet of publications in the Leber's hereditary optic neuropathy. And we have a wonderful genetic scientist who are joining hands with us in all our research collaborations. And we have quite a strong hold on the LHON management. And it is improvised a lot from what I saw 3 decades back to what we are now. And these are some books which are released by the Department of Neuro-Ophthalmology at SN. And the best thing is this was the first Atlas of Neuro-Ophthalmology when we released it in 2002. And in this atlas, all these textbooks, we have used the images of pictures of our own patients, and none of them are sourced from any other sources. So that is something which was, very heartwarming. And Chief was behind this entire brainchild of bringing the Atlas of Neuro-Ophthalmology. And coming to the conferences, and our team has been part of many national and international conferences, and we have also conducted a Synapse, which is a pet conference to most of the ophthalmology postgraduates and across the globe speakers also. It is the Symposium in Neuro-Ophthalmology Afference plus Efference, which is coined by none other than Smitha, our department consultant, as Synapse. We have started conducting conferences way back from 2002 to 2024. And these conferences did serve as a vital platform to share our knowledge, exchange the innovative ideas, and also learn more from globally renowned neuro-ophthalmologists. So this is the first neuro-ophthalmology conference in India in 2002. You can see the first neuro-ophthalmology department over here. And those days itself, Dr. Andrew Lee, Professor Cullen, Dr. Robert Daraf, and Dr. Suresh Babu and Dr. Bala, many of the neurosurgeons in Chennai and international neuro-ophthalmologists did participate in 2002. And this was in 2009 when Professor Neil Miller started visiting us. And this is Peter Savino, and this is the group of international speakers who joined us. And it was a well-attended conference even earlier that time. And since then, Dr. Neil Miller has been strongly supporting our department activities, and he has been really, helpful in our global learning platforms. So this is Synapse 2016 and with the new team, and there are a lot of invited speakers across India as well as internationally. You can see the head of PGI Chandigarh, Dr. Vivek Lal. He was awestruck to see the amount of challenging cases what we discussed in those Synapse meetings, and this made a platform to us to connect with the neurologists in India who are inviting us to be part of many of their neurology congresses, which I feel is something which is very, very nice for an ophthalmic institution to grow as. And this is in 2019, we had the Synapse Part 2, where we had Dr. Nancy Newman and Dr. Valerie, who were the stalwarts in neuro-ophthalmology, who joined us. And in fact, they released the road traffic accident awareness teaser for us in 2019. And all this is not possible without our secretarial team. A special mention to Ms. Usha, Ms. Subhashini, Mr. Shrikant, who have done a wonderful job in helping us to continue these services. And we also had the opportunity to host the 6th annual conference of INOS in September 2024, where we had a wonderful collection of internationally challenging cases discussion. And we also had Professor Kashi, who is from Japan, visiting us for the 3rd time. And he was really happy to see the good work, what we do in Shankar Nethralaya. So this is my picture, which is close to my heart, where I share as Vice President of INOS the space with the past president of INOS, Dr. Naveen Jayakumar, and the current president of INOS, Dr. Rashmin Gandhi. So with this note, I conclude saying that this is the SWAT team, what we are having right now in neuro-ophthalmology in Shankar Nethralaya, which is really brilliantly led by Dr. Shekha Basi, and she's doing an immense work in the neuro-ophthalmology leading job. And this is the team which is really good in doing a specialized center of excellence in providing neuro-ophthalmic challenges across India and neighboring countries. Thank you so much to my teachers, and thank you, Dr. Sujata, for this opportunity. With this note, I sign off.
Thank you, Dr. Ambika. That was an excellent overview of the neuro-ophthalmology department. You spoke very fast, but you covered everything. It was really good. And Dr. Naveen Jayakumar for his comments and his experience at Shankar Nethralaya.
Yes, I think Sujata has summarized everything. There's not much left for me to say, and Ambika as well. So I just wanted to couple of things that have stood me in very good stead, and which has been mentioned by many people here already over the series of this past 1.5 hours or so, is that very strict adherence to protocols in Shankar Nethralaya on almost obsessive level. And quite often, I think many of you might have been chafing as to why is so much being given to protocol, the way things are examined, the way things are done. And I think over time, you realize that the presence of these protocols has really improved us as ophthalmologists. It's made an average ophthalmologist a good one, and a good ophthalmologist a great one, just by adhering to the protocols. And when protocols are lapsed, and that's when problems happen, and it has happened. even in Shankar Nethralaya, especially when suddenly one VIP walks in and changes the protocol. Okay, so well, that was that. And I think also many of us have been wondering. I think each of us has a story about Chief's zero tolerance of even apparently the most trivial issues as to whether the bathroom is clean or some instrument was not working in the OT, etc., etc. And we used to wonder at those outbursts of it. But I think those of you who are running hospitals now realize how important it is to be obsessively focused on even the trivial issues and demanding 110%, because then you will get 100% of work. And I think those who worked in Nethralaya those days and probably even now will realize when you step outside and see other institutions, not just ophthalmology, but even otherwise, there is this kind of acceptance of mediocrity nowadays, which people say that chalta hai attitude, it's okay, spelling mistakes here, this thing. I think that's where we realize how much Chief has instilled all this in us. So my first is my pranams to Chief for also giving me this particular option. He first gave me Orbit, which I said was a general surgery kind of thing and not my cup of tea. Apologies to Dr. N.S. ma'am. He also told me to do medical retina, but I had told him that I wouldn't know one series of red and yellow dots from another one. And Neurophthal was given to me, and I was really happy with it, and I'm still so happy that it was given to me that way. One thing I have to mention is when I started in 92, I was given neuro-ophthalmology in February or so. And at that time, Dr. JB was out of station. I think he was doing something in the US. And so the UVA department was being manned by a very young Sudha Ganeshan. And neuro-ophthalmology, there was no one else. And of course, Dr. Lingam Gopal had not just his old VR list, but also neurophthal cases and a couple of UVA cases to see as well. So if you remember those papers of appointments, you scroll outside the table. But he was so patient, and I can't tell you how patient Dr. LG was to actually give me one of his 2 rooms to see neuro-ophthalmology patients. And I would take maybe 10, 15 minutes over one case where he would have seen up 3 VR cases by then, So that is the extent of patience for which I'm immensely forever grateful that you have a teacher like that. And today I will say that what we are today is because of how we have been taught. So we have had excellent mentors, which have made us who we are today. And also, I think we have excellent students in whose shadow we are, in whose reflected splendor we are shining in. And so I'm particularly mention Ambika now, who's the vice president of INOS, and Drashman Gandhi, who's the president of INOS. So what more can I ask for? I think my cup is full and I'm happy. Thank you.
Thank you. Thank you, Naveen.
So next we go on to the cataract department. Request Dr. Sripriya Krishnamurthy to give her talk.
Screen. How do I share my screen? Is it all visible?
No, it's not.
Not yet.
No. Entire screen, Windows, yes. Yeah, now it's seen, right?
Yeah.
Make it close.
I'd like to thank Dr. Sujata, Dr. JB, and Dr. GSR for involving me in this story of Nethralaya. Community ophthalmology, by definition, is preventive, curative, promotive, and rehabilitative activities of eye care, making it a holistic approach with clinical ophthalmology as its core and public health sciences in its dimension. I think this just spells out the essence of Dr. Badrinath's concept of community ophthalmology. Right from inception, there used to be free section free patients who used to be seen in the evening OPDs. And as the finances of the institute built up, we started having weekly camps in 1987 and eventually a separate branch for free patients in 1997. He always believed that it has to be manned by a dedicated team of ophthalmologists, because unless there is a group who's there, both the attention to the patient care as well as to the community ophthalmology development, he always felt will be incomplete. So they do about 15 plus trainees are trained by them and doing about 40-50 surgeries a day and an OPD of 250 to 300. And the community wing was one of the first eye hospitals in Asia, including the community wing, to acquire an ISO certification right in those days. And he believed in comprehensive eye examination, even in the community wing, involving a complete slit lamp examination, applanation tension, indirect ophthalmoscopy. And the patients who needed cataract were admitted, made clean before they are taken into the theater, where quality eye care was delivered, and the patients were sent home with a fresh bunch of medications and sterile tissues to take care of their post-operative period. Our cataract surgeries grew over the years to over 15,000, but the number of fundus fluorescent angiography, OCTs, ultrasounds, and the non-cataract surgeries that are being done every year is an indirect reflection of the stress on comprehensive eye examination that is being practiced even today. He then decided that it's not enough if we do community care locally, we need to take it across the country. And so India's first tele-ophthalmology bus for villages was introduced in 2003. Whereby modern technology was taken to the masses. Till date, more than 9 lakh people have benefited from it, both here in and around Tamil Nadu as well as in West Bengal. There also the same comprehensive eye exam takes place, teleopthal consultation occurs, glasses are dispensed locally, and the patients who have diseases other than cataracts or refractive errors are referred to wherever hospital they have close by. The community epidemiology studies, both the Chennai glaucoma study as well as the diabetic retinopathy project, both in Chennai as well Tamil Nadu as well as in Karnataka, is a reflection of his further growing concepts of epidemiological care. Unless we know the magnitude of the disease, we will not know the correct treatment to be planned. The next was how to take the surgery to the people who were in the peripheries where we have detected the disease. That's when he conceived the unimaginable concept of a mobile surgical van. Till date, more than 20,800 surgeries have been done there and more than 1.32 lakhs screened. No post-op infections till now, God bless, and more than 85% of patients have got back 612 or better vision. Parallelly, the entire theater is modeled into a bus which goes as 2 pieces to take the care right to the doorstep of the tribal areas. It's not enough if we do preventable curative treatment. We need to take care of the preventable blindness. And so Shankar Nethralaya started the comprehensive school screening in 2011 in the form of SNCs, and now in preschool children in the form of SN6 in 2025. We also have the SNDs that takes care of the elderly and the bedridden at home, the vision centers with Rotary, and also they conduct public health awareness programs for the masses. All this is not enough. We need to take the training and the quality eye care to the rest of the country. So how do we do that? Just like all the other speakers have told earlier, he started the paramedical training as well as the training for the ophthalmologists. When somebody interested in the overall upliftment of the eye care of the country meets somebody who's interested in supporting the country with projects for development, there comes the Sir Ratan Tata Community Ophthalmology Program, where more than 700 ophthalmologists across the country have been trained both clinically as well as surgically in cataract surgery. More than 2,000 patients done by them have been evaluated, and the quality of eye visual recovery has been at par, if not better, than universal standards, which is a reflection of his stress on quality care. All this quality speech will not be possible unless we have quality checks. Dr. Badrinath used to make it a point to ensure that every day he gets a report about the community care so that there is no untoward incident going on and there's no slackening of the system. So he always built upon the fact that if you have a system in place, things will automatically fall into place. So every postgraduate fellow who comes to Nethralaya has to pass through the system so that when they emerge, they know by doing the system, you eventually find out any disease that the patient has at that point in time. Random checks are done, both of the files as well as even things like the toilet and the food that the patient consumes, and untoward incidents are evaluated by him. The OT theaters have the same quality checks as the paying side, and all these surgical training will not be possible unless there is a wet lab training. He believed that supervised learning is the way to go, and most of the candidates are independent before their 10th phaco. We now have a VR module to train for phacos as well as a Help Me See module for a small incision cataract surgery. All this will not be possible unless his dreams were being taken to the masses by self-motivated individuals. He had the knack of finding the right person for the right job. This is the school screening team, the Mizu team, especially Dr. Rashmin, who have sat with IIT to plan the surgical Mizu bus. The present Mizu team that is taking care of the village screening and the surgical treatment, and the community ophthalmology team, which ensures that the postgraduates learn ophthalmology as well as the ethics and morals. To sum up, I'd like to end with Dr. Badrinath's some of his choice statements to me. Teach like you'd like to be taught and treat like you'd like to be treated. In his eyes, we are equal, so why differentiate the haves and the have-nots? More than numbers, what you transmit in those numbers matter, Dr. Shipriya, so you might as well buckle up your and if you can teach even 1 out of 10 persons under you ethics, morals, and values, I have won in my dream of starting training. They can learn ophthalmology anywhere, ma. So that was his favorite statement. Thank you so much.
Thank you.
Thank you. Wonderful talk, excellent talk, and really much needed, because one of the visions of Chief was the community ophthalmology, and you've really brought it out well. Can we have the comments if she's available? Dr. PP, ma'am? Your comments, ma'am. You're muted, ma'am. You're muted.
Am I audible now?
Yes, ma'am.
Yeah. I know that most of us refer to cataract surgery as just a cataract surgery. But apart from being the most commonly performed intraocular surgery, it has reached a level of sophistication that allows it to qualify as a refractive procedure now. But what I think is remarkable is the way in which we in India, and particularly in Shankar Nethralaya, we've been able to democratize much of that sophistication, even in our community outreach programs. What I think is even more remarkable is in the way in which Shankar Nethralaya has harnessed the power of technology in training surgeons in modern cataract surgery. Dr. Akshay spearheads the Help Me See simulator training program that you just saw briefly, that uses virtual reality that will make the learning curve less steep and real surgery more safe. So it is very gratifying to know that Shankar Nethralaya continues to ensure that the benefits of progress extend to all sections of society, like Dr. Shipriya narrated in her own inimitable way. Thank you, Sujata.
Thank you, ma'am. I request Dr. JB to introduce the lab department.
I'd like to introduce Dr. Angar Karni, our Director of Laboratory Services. Dr. Laboratory Services is the backbone of Shankar Nethralaya. What makes Shankar Nethralaya different from other institutes is a very good basic science backup, not only for the clinical activities, but also for the research activities. And Dr. Angar Karni is doing the pioneering work and making the laboratory services standardizations. And she will give us a glimpse of what within the 6 to 10 minutes time about laboratory services of the various branches of laboratory services at Shankar Nethralaya. Dr. Angar Karni, please.
Yes, sir. Thank you, Dr. Vishwas, for giving a platform for the laboratory as well. Let me share my slides.
Great. Make full screen, please.
Screen. Good evening to everybody who has assembled here. I would like to share our laboratory services since the inception of Shankar Nethralaya and the research sciences that we have at Nethralaya. So the clinical laboratory of Shankar Nethralaya was started in the year 1982, though Dr. Vasanthi had started initially in the premises of the Vijaya Hospital as BB Hospital. And thanks to Dr. Vasanthi, who has generated such a big laboratory that has grown up so well. So it was then renovated as well, and with most of the laboratory sciences began in the main laboratory. But later in 1989, microbiology came out as an independent facility, and biochemistry in 1985, headed by Professor Ramakrishnan, and ocular pathology in 1986, and genetics started by Dr. Vibhashkar Kar was then promoted by Dr. Kumar Manikvel. And Dr. H.N. Madhavan was the key person to have integrated the basic sciences with the laboratory sciences and grooming us into a big group. So we started with all manual method and semi-automated method with in-house quality control programs devised by the doyens of the laboratory heads, with the background of total quality management in the institution, which set up the platform for the quality control. Later in 2005, referral lab was instituted under the headship of Dr. Madhavan. And now recently, a few months back, we dedicated this facility to the memory of our beloved Madam Dr. Vasanthi Badrinath. So the progress became an upscale with getting into NABL accreditation, which started with an application in 2005, again initiated by Dr. Madhavan. And in 2007, we had the first certification, and ever since there was a no go back. It proceeded to the next levels of upgraded standards that we had, which means that we had to improve our infrastructure facility. So we had all the state-of-art facility in all the laboratories, which had the high throughput routine work taken up, supported by the laboratory information system, which connected to the EMR, all our data without manual interventions, and all third-party calibrations of all the equipments maintained so well. We also have the collection facilities that were accredited, though they were started much earlier. 1999, the JKCN facility had started as a routine laboratory, but then subsequently in 2012, it was made as the collection centers. So we then had collection centers in the Navasuja, which is now relocated in the SNRA Puram. And we also had it in 2014 in the CUSSN campus. So all the three collection centers are accredited, and the samples flow to the main laboratory for all the testing. So now we have, in the last 2 years, upgraded to the next level of accreditation, which is the most recent, and we are one of the early birds to have taken up this accreditation in the laboratory, that is ISO 15189-2022. So this month we are going for the recertification as well. So that gives us a scope of testing that includes 282 tests that we offer, which also includes 43 panels that are devised exclusively for our consultants for an easy request of the testing. And we have MOU with the Metropolis and other places. So we have another 76 tests added to this for facilitating our clinical consultants' requests. So we do around 3.86 lakh investigations per year in the Department of Clinical Biochemistry, Hematology, Clinical Pathology, Microbiology and Serology, the Molecular Diagnostics, the Histopathology, and the Genetics year after year. And this is strongly supported by extensively established quality assurance program, not less than 18 external assessment programs, which are stringent to make sure of the quality control that is the backbone of all the analysis that we do. I'm not going into all the tests that we are doing. All these details are there in the website. All the special investigations that are being done in all the laboratories is also present in the directory of services, which is available at the website. So what I just wanted to share with the newly introduced point of care device across all the centers of Shankar Nethralaya. So we have done around 3,500 tests already in the POCT devices that we have used for emergency testing, which includes a chemistry of 8 tests, which is the Chem 8 panel, PD-INR, as well as the drop eye for any emergencies. And we have attended all the training programs that gives us the guidelines for releasing the reports from a point of care device. We also have another point of care device, which is a little high throughput in terms of the panels that I've listed here. It includes thyroid profile or NT-proBNP, vitamin D, cortisol, etc. So we are expanding the number of tests that we could offer to the consultants who interact with us periodically, to decide on what panels do we require or what tests that we require and how much of it we can bring it in-house. To this list, we also have the molecular diagnostics lab, which was once the referral lab has been brought inside the campus. So we have the PCR-based testing that is being done, which includes real-time PCR apart from the conventional PCR. And we have a sequencer which takes care of the sequencing as well for the exact identification of the organisms. And these tests are also now getting included into the accreditation, and the molecular diagnostics takes care of the request from 60 other hospitals in Chennai. And also outside Chennai, we have another 12 institutions which avail our molecular diagnostic facility throughout the year. And the whole laboratory professionals are trained exhaustively throughout the year. A lot of certifications that we make sure of. We have the genetic counseling done by certified professionals from the genetics department, Dr. Shripriya and her colleague. And we have even the certificate for the HIV testing and counseling to be done by Dr. Suman, who's our pathologist. And we have undergone all the Six Sigma training as well, and the periodic conferences that we conduct, or the laboratory professionals day that we celebrate, to invite a lot of the experts in the specific fields of diagnostic sciences. And we do participate in such conferences as well in exchange of the most prominent analysis that are being done in the country. So now with all these doyens who have started the departments, we now had the second level of laboratory professionals who took the lab forward. And now we have the third generations, Dr. Suman, Dr. Anand, and myself, Dr. Krishna Kumar, and Shripriya, who are running the show. And our laboratory have won a lot of rollers. I'm just listing a few. We got the Award of Excellence for our phlebotomy unit at a national level given by the BD Sciences, and many other awards won by the technical group as well. Dr. Krishna Kumar has been continuously listed as the best doctor as a pathologist since 2022 till date as a city pathologist from the Outlook. And all the departments are publishing their analysis that they do, and a lot of book chapters that we periodically also have. So I'm giving just a glimpse of the wide variety of activities that we are into in the laboratory science. Now, with this background of laboratory science, we are most of us are also involved in the basic science research as well. And we are connected by the academic activity that links us to the students community. So we have the medical laboratory technology course, which was instituted long back by in collaboration with the BETS Pilani. And later on, it was affiliated to the MGR Medical University, which is now run by the SANKARA Academy so well. And we have the PhD program registered under various universities, not only BETS Pilani in the earlier days, but also the MGR Medical University, and now the Sastra University as well. And we have internationally with the Deakin University, apart from the Anna University. So we have all this, more than 80 plus PhD candidates have come out from the basic sciences department. And currently we have 18 of them doing their PhD programs. And most importantly, we have the MLT, Medical Laboratory Technology program, undergraduate and postgraduate courses. And we also teach the Elite School of Optometry on the various basic sciences. The third point is that we run a lot of training programs on the techniques that we are into. So we call it under various categories of observership or internship, or summer has hands-on training programs. And we have more than, nearly 1,800 students who have benefited from these short-term programs out of this entity, which is all under the forum called the Vidyasagar Institute of Basic Medical Sciences. Now, coming to the scientists team, The Department of Microbiology, as we know that Dr. Madhavan was the pioneer in creating this, the first of its kind for many of the PCR-based tests that were introduced for detecting the infective agents, and the pioneering work in Eels disease to identify the Mycobacterium tuberculosis association, and the viral laboratory and intraocular infections in terms of viral infections. He played a major role. And see, the vitreous fluid and aqueous humor were our specimen that were giving us a lot of information about the disease pathology. So they had 4 patents which had come out of this from this laboratory for the PCR-based diagnostics. And now the current focus of research is all about antimicrobial drug-resistant mechanisms. Dr. Anand and his team are working on it. The metagenomics of the ocular surface microbiome and characterization of various ocular pathogens. They have also in diagnostics introduced more tests like NMO and MOG for the neuroophthalm and uveitis departments. And most importantly, they are playing a key role in the surveillance activities of the department. As far as the biochemistry department is concerned, looking at the research, the past research, Dr. Ramakrishnan had a pioneering research which gave him the BC Roy Award for his work on amino acid formulations that have anti-cataract activity and anti-diabetic activity, especially the lysine. And a lot of work on congenital cataract, especially the way of screening galactose in urine that can prevent early detection, and restriction of milk and milk products can prevent the birth of the congenital cataract. These are monumental work done by Professor Ramakrishnan. And how cadmium toxicity can promote cataractogenesis is another work. So Eels disease has been a major area where they had more than 15 publications and 2 or 3 PhD programs that had come out of it, where they had shown how inflammation is preceded by acute phase reactive proteins and altered iron metabolism that constitutes to the oxidative and nitrosative stress, playing the role in the disease mechanism. Subsequently, when I had joined, I had explored tear as a specimen, to explore the tear proteome to relate it to the various types of dry eye symptoms, chiefly Stevens-Johnson, the Sjogren syndrome. And we moved on to lipidomics and cytokine profiling also to relate to the ocular surface disorders, disease mechanisms. And we were also the first to report on many molecules that were very novel in the ocular scenario, which includes a list of molecules that we have seen it as publications. And thirdly, I would say that we were very happy to establish a lot of cell lines to create cell models for the disease mechanisms to be studied, which includes the primary as well as these cell lines, both the retinal cells as well as the anterior segment cells, which has helped us to do a lot of preclinical studies, which was taken forward by the current scientists, Dr. Bharti and Dr. Sharda. So they are looking at the copper overload and trace element dysregulations that are associated with mitochondrial dysfunction. And one of the key findings was that when you inhibit that copper transporter, it can be anti-angiogenic. So it has fetched us a couple of patents which are about intervention targets, where they had designed small molecules which are siRNA based or peptide based. So the department has 4 such patents which are chiefly catering to the anti-angiogenic mechanisms. And the current projects are also focused about the RNA modification and the epigenetic changes associated with various diseases, chiefly diabetic retinopathy, glaucoma, and thyroid eye diseases, and intervention molecules also to regulate fibrosis in ocular diseases. So most importantly, in the biochemistry, we also support some of the academic queries which are case specific. That way, we have supported the clinical request on identifying the specific steroids in a subconjunctival deposit, or it came up with locating the myeloma protein in aqueous humor. These were all the first reports. So I'm just giving an example of the clinical and the basic scientist interactions in understanding specific cases that were very unique, that has resulted in very good publications as well. So this scenario exists in all the basic science departments. I'm just relating some of them in the biochemistry. Coming to genetics department,
Can
we
you
were the first.
summarize, please? Because we are
Yeah.
running very much late and it's
Yes,
going.
ma'am. So they focus on the whole mitochondrial genome sequencing and microRNA based biomarkers. The SN Dream studies has done a lot of work to identify novel molecules that are genetic determinants in the diabetic retinopathy. Jiva studies have identified a lot of new novel loci. RPE65 mutation is their major contribution. And coming to ocular pathology, the studies on retinoblastoma, uveal melanoma are major contributions from Dr. Vishwas and Dr. Krishna Kumar. And aptamer research is one of their major outcome, which has helped in the, also in developing diagnostic assays based on these aptamers, which is a very recent one. So their research is focused on that. Nanotechnology is another facility that we have, which is working on the mechanistic studies of various corneal fibrosis involving diseases. So they have all the facility to do the mechanotransduction study. So he's available for you to contact on any of these facilities, which are very uniquely present at Shankar Nethralaya. Stem cells cater to the human amniotic membrane supply to our ocular surface department and corneal department. So their research focus is all on the Muller glial cells and the HIV and tuberculosis infections, the immune derangement in these conditions. So bioinformatics is the facility where it focuses on the multi-omics approach to identify novel drug targets and identify the new molecules that can be very promising leads. And they have come out with a lot of platforms and tools that are available for anybody to use. So they are now focusing on also the AI-driven molecular design for drug target delivery, chiefly in glaucoma. And I express my gratitude to the TNOA for this opportunity to share about the laboratory sciences. And on behalf of the scientists and the laboratory staff, I extend my thanks.
Thank you, Dr. Angarkani. I know it's difficult to summarize so much activities working in the department. We'll go to the next. Sujata?
Yeah, please introduce Dr. Girish Rao, JB.
Yeah. Dr. Girish Rao is the president of Shankar Nethralaya Medical Research Foundation. He will be summarizing that what are the recent things going on, our foundation and the road ahead. Dr. Girish, please. This is the
You're
last.
muted.
I think she is muted.
Muted.
Yeah.
Girish.
Are my slides visible?
It was visible. Disappeared.
Visible before.
Now it's visible. Now it's visible.
Okay.
Yeah, thank you.
Good evening and thank you everyone for staying on so long. It's both an honor and a responsibility to speak about the future of this iconic institute, an institute that has become synonymous with excellence, ethics, and equity in eye care. Founded with a visionary mission to eliminate needless blindness, SN has grown from a single center into one of India's most respected ophthalmic institutions. It stands today not merely as a hospital, but as a movement that combines compassion with cutting-edge science. And as we look forward to the future, our journey ahead will be guided by three core pillars: excellence, expansion, and equity. The future of ophthalmology is being reshaped by AI, precision medicine, gene therapy, and advances in imaging technologies. SN will continue to lead in adapting and developing these innovations. We envision expanding our research footprints in retinal genetics, ocular surface surgeries, glaucoma management, India-centric UVA practices, trauma care, aesthetics, neuro-ophthalmic therapeutics, and pediatric ophthalmology. Collaboration with global research institutes, investment in translational research, and strengthening clinical trials will ensure that breakthrough technologies in the laboratories translate into sight-saving solutions at the bedside. India still carries a significant burden of preventable blindness, particularly in the rural and the underserved region. The journey ahead calls for a deeper outreach, and the mobile eye care units, teleophthalmology platforms, and satellite centers will be strengthened to reach communities where access remains limited. Technology will play a transformative role. AI-driven screening tools and digital integration across our centers will ensure continuity of care. By building a robust digital health ecosystem, SN will continue to serve as a national model for scalable eye care delivery. Expansion also means strengthening our training programs. The future of this institution lies in the hands of young ophthalmologists, optometrists, nurses, and vision technicians. Enhancing the optometry program with bachelor's, fellowships, master's, PhD programs, and our surgical simulation training through global academic exchanges, it will ensure that the next generation carries forward the same values of the clinical rigor and ethical practice as was practiced by Dr. Badrinath. The Elite School of Optometry will continue to spearhead optometry education curriculums in India and in the Southeast of Asia. What makes Shankar Nethralaya truly special is its commitment to serving all sections of the society. And as we move forward, the commitment to cross-subsidy models, free surgeries for the underprivileged, and community screening eye camps must and will remain non-negotiable. The future plan will include expanding partnerships with NGOs, government programs, and CSR initiatives to ensure that no individual loses vision due to financial constraints. But beyond infrastructure and innovation, the true journey ahead is about values. In an era where healthcare has become commercialized and impersonal, Shankar Nethralaya will continue to stand for trust, transparency, and patient-centric care. Every patient walking in through our doors will continue to feel respected, heard, and cared for with dignity. The road ahead is long, but the vision is clear. Together, we'll ensure that Shankar Nethralaya continues to illuminate lives not only in Chennai, not only in India, but across the world. Thank you.
Thank you, sir.
Thank you very much.
Any questions from anyone? Can we close the program?
I'd like to thank Sujata for giving us the opportunity for Shankar Nethralaya and to us to have this novel webinar and meeting where we can really showcase our facilities and that our values and what Shankar Nethralaya stands for over the years. Thank you very much.
Sir, I think before we close, I think we should all take a minute to remember Dr. B.K. Nair, who was Dr. B.K. Jain, the head of Sadguru Netra Chikitsalaya, who passed away. I think he was a remarkable individual who brought tertiary eye care to the remotest of area. So I think it's appropriate that we all observe a minute of silence in his memory. Thank you.
Thank you, sir. I'd like to thank once again all the faculty from Shankar Nethralaya and also the faculty who were no longer there, but who spoke from outside. The entire philosophy of Shankar Nethralaya was shown here, and we're all blessed to be in the institution, to live in the times of Dr. Badrinath, who had so much of foresight. And I'm extremely grateful for the support given by Dr. TSS and Dr. JB in making up this webinar a great success. And also we are greatly thankful for the honest insights given by the different departments. And that goes to show how much of expansion Shankar Nethralaya has happened over the past 4 decades, and how much more is going to happen. We're immensely proud of this institute, and really thankful once again for giving TNOA this opportunity to host this webinar. Thank you.
Thank you.
Thanks, thanks, JB.
Thank you. Thank you. Thank you, everybody.
Thank you. Thank you.
Good night.
Good night.
Thank you, sir. Thank you, madam.
Thank you, everybody.
Thank you.
CS has gone to
Thank you,
sleep.
madam.